Hi everyone, Ashlyn Giza YouTube channel. Today we are going to talk about hematomas. So the reason why I decided to talk about hematomas today is because I had a dental appointment about oh a week and a half ago, and I had, unfortunately, this is embarrassing to say, but I had 3 cavities on this side, 3 cavities on this side, and so both sides of my mouth I had cavities, and I brush my teeth every day and stuff like that. But here's the kicker. So if you just started following me, I'm a cancer survivor. I have no thyroid due to cancer. I if you can see my scar right there, I had my thyroid removed in October 29, 2018. And so, what not having a thyroid can do, one of the things it can do is cause you to have a dry mouth, the medication and not having a thyroid and everything. And so, because it's a hormone, and it can do things like that. So it can dry out your mouth, and then it can cause you to have cavities and lose your teeth and things like that. So, um, I just have to make sure that I need to start drinking more water and stuff like that. But so it's not, cavities and stuff aren't always caused from bad hygiene. Sometimes it's just it can be a hereditary thing, like, or it can be a disease like something I have, or anything like that can cause rotted teeth. And doing drugs too, but I don't do those, so that's not what it is. But I had my dentist and my brother-in-law, who is my dentist, work on my teeth, and I so he had to stick these Q-tip looking things in the side of my mouth that he was working on, which was my left side, and then it numbed everything up. And then he, after that, did an injection with Novocaine, or lidocaine. I'm not sure how you pronounce that very well. I'm not a dentist, obviously. But the numbing stuff, he injected that with a needle in my lower cheek gum area. So that way everything would be completely numb when he started working on my fillings. Um, and drilling away, off the cavities and nastiness off my teeth over here. So, I think after he did that, I don't know if there's some bacteria that was in my mouth when he injected it. I don't think that's the case. I don't know how it really happened or how this happens, but because again, I'm not a dentist, but he, after he injected it and worked on my teeth, I woke up the next morning and I had a knot in my lower jaw, and it was really sore, and it felt like a bruise, and this sounds weird, but it felt good when I rubbed on it. And bad idea, because after I rubbed on it, of course, obviously, after I rubbed on it, it made things a little worse. I could tell it was very inflamed. It was kind of puffy in this area of my cheek. There's still a little off filling there, but it's not as painful and bad filling as it was before. So I reached out to him, let him know my symptoms, and he just said it could be sore from the injection site, where he injected the needle, or which is obviously common, or it could be a hematoma. So I'm thinking it was a hematoma because he told me to, rest, put ice on it, put a heating pad or a warm cloth on it for 15 minutes, ibuprofen, and see how things go from there. And it should be feeling better. And I did that, and it seems, like I said to you guys a second ago, seems to be better. There's still a little off feeling there, but I bet you by next week, I'm probably not even going to know I ever had anything like this. So, I'm thinking it was a hematoma though, because of just the things that I researched and read on the internet. He never said that I had a hematoma, but I think that it was, or is, because it's still kind of there. So I'm gonna read to you guys about what a hematoma is. A hematoma is a bad bruise, and it can happen when an injury causes blood and gives the skin um, a rubbery, lumpy feel to it. A hematoma is usually not a cause for concern. It is not the same as a blood clot, and doesn't cause blood clots either. So, blood vessels are routinely injured and may leak blood, causing hematomas or blood clots, depending on the severity and the location. So, that's only depending on the severity and location that it can cause a blood clot. Other than that, it's usually not anything to worry about. So, like I just said, they can be insignificant or they can be life threatening and damage. But you can use ice, heat the next day for 20 minutes, or 15 minutes, 15 to 20 minutes, ibuprofen or CBD oil, or just CBD in general. Any anti-inflammatory you can use. Again, I'm not a doctor. Other risk factors can be excessive alcohol use, blood cancers, bleeding disorders, chronic liver diseases, and low platelet count is what can cause a hematoma. Um, some like signs of a hematoma are redness, discoloration, inflammation, tenderness, and warmth in the skin and pain. So the reason why I think it was or is a hematoma is because I had most of those symptoms. I had a little bit of redness. I had definitely had inflammation, definitely had tenderness, definitely had pain and warmth in that area. So that's what makes me think I had one. Um, and again, he never said I had one. He said I could have one, but he didn't say that it 100% it was. Um, so hematoma can occur in arteries, capillaries, and veins. Very common problem where hematomas can be are ears, where like boxers or wrestlers can get them. Um, they can be in the skull or brain or inside an abdominal cavity. A scalp hematoma, spinal, spleen, or under your fingernails. Usually they are caused by an injury or trauma to the blood vessels, and blood thinners may help in certain situations. Now, obviously, in my situation, I'm not going to need one because mine was just I had like a little tiny knot, probably maybe about that big right here. And from last week, even it's went down. Um, and then if it is serious, you may need surgery, but that's only if it's serious. Um, so for dental, a hematoma can be the injection from the injection of a local anesthesia. It's usually safe, but a rare complication of the extraoral hematoma. So cases for hematoma can be car accidents, falls, dental, which is my case, and cosmetics. So that's a little bit about hematomas. Like I said, I think that mine was caused definitely from the injection site because you shouldn't be touching or fiddling with the area if you do think you have a hematoma. But before I knew what was going on, I was like, oh gosh. And I was kind of poking my cheek like this, and I even stuck my finger in and kind of tried to feel where he put the injection because I was wondering if that was what it was from, and something I shouldn't have done, and I'm aware of that, but we're all human, and sometimes when stuff like that happens to us, we kind of poke around in our bodies and see what's going on. So I kind of stuck my finger in my mouth in that area, and sure enough, when I stuck my finger to the area on the inside and kind of pushed down, it was exactly where it was hurting and kind of swollen. It was showing where my finger was whenever I put my finger on the inside. So if I put my finger on the inside of my lip right there and push up on my lip ring, obviously I'm pushing up in the area where my lip ring is because my lip ring came out. It projected. That's what I was trying to do with this area in my cheek. I was trying to stick my finger in and kind of press down to see where my finger was touching from the inside to see if it was where the spot was in my cheek, and sure enough it was. So it more than likely was from the injection site. um I've never had that happen to me before in my life. But as he was telling my husband and stuff like that, that your body isn't symmetrical. Your body isn't the same everywhere. So even though it didn't happen to this side of my mouth, it could happen to this side of my mouth or anywhere else in my body, because it just can happen anywhere in your body. That's the answer for it. It doesn't have to it just because it didn't happen in any other area of your body doesn't mean it can't happen. So it's like I said, it's been about a week. So I'm waiting for it to fully heal. It's way better than it was before, but I can still tell that there's a little bit of tenderness. But the good thing is that it's getting better. So if you think you have a hematoma from the things that I've said, and other videos you've explored on YouTube and things you've Googled and stuff like that, talk to your dentist, talk to your family doctor, talk to your surgeon, and see if they can figure out if it is one or not for you. Because again, sorry, I had to sneeze. Again, I'm not a doctor. So, um, just these are some signs and symptoms. If this video helped, give it a like, or comment below if you have any questions for me or a story to tell me or anything to add that I didn't say. And I will be on with another life topic. Thank you.